will be moderating the call today, and I'm a member of the ESRD National Coordinating Center team. So today's topic will focus on how we might improve outcomes by selecting key best practices from the various OKR change packages. In addition, you can expect a great example of how selecting key elements from the transplant change package has led to an increase in transplant referrals and patients being added to the transplant wait list. A few meeting logistics just to take note of. The call is being recorded. All participants are muted at this time. However, we do want to hear from you. So please note the chat box located at the bottom right-hand corner of your screen. Please feel free to drop comments or questions there as we go throughout the presentation, and we will respond to those questions and comments during our Q&A period. Finally, the materials and recording will be posted on the ESRD NCC site within the next 5 to 7 business days. So who is on the call today? We have a number of dialysis facilities and transplant professionals, our ESRD network staff, our CMS colleagues, as well as patients and family members are on the call today. So our key objectives for today, we're going to provide an overview of the various change packages. We're going to discuss strategies to improve key performance indicators by utilizing the change packages. And we're going to identify primary and secondary drivers from the transplant change package to improve referrals and waitlist outcomes. So a Learning in Action Network call. So the purpose of this type of call is to spread best practices. We want to take the opportunity to listen and share your approaches and experiences, so please utilize our chat function. We want to identify how that shared information can be used in your facility. We want to think about applying at least one idea from today's LAN call at your facility, and commit to sharing what you've learned with your colleagues. So questions to run on are ideas or thoughts that we want you to think about as you're listening to our presenters today. So a couple of things to think about: how might your organization implement change ideas from the change packages? What are the possible benefits to your organization in using the change packages to improve your key performance indicators? And how might your organization use the transplant change package ideas to improve transplant referral and waitlist processes? So before you see on this slide an example of the different change packages that we currently have. The change packages were developed from semi-structured interviews with high-performing dialysis facilities, many who are on the call today. The change ideas presented are intended as a menu of proven interactions that resulted in positive performance outcomes. Program leaders may choose to review and implement ideas to support the growth of their home program by selecting actionable items to increase the number of patients using home modalities, reduce hospitalizations, avoidable readmissions and emergency department visits with their hospitalization change package, improve the patient's experience of care, and increase the number of patients receiving vaccination and boosters, such as COVID, influenza, and the pneumococcal vaccines. Additionally, the ESRD National Coordinating Center is currently developing change packages for depression, access to care in skilled nursing facilities, which are focused on reducing infections, peritonitis, and blood transfusions, as well as a health equity change package that's in development at this time. And finally, the transplant change package, which will be the focus for our discussion today. So we want to pause for just a moment and take a poll. So are you familiar with the ESRD NCC change packages? So I'm going to open the poll right now. All right, I see lots of responses in the chat. A nice mixture of yes, they've used the change package, and then some responses not so much. So for those that are not familiar with the change package, we certainly hope our presentation today will spark more interest in it, be able to answer some of the questions that you have, and allow you to be able to learn more and be able to implement some of those best demonstrated practices in your organization. All right, seeing really great responses here. So we're going to close our poll. All right, so if we can currently see out of 119, we have about 27 participants that have used it, are not familiar with the change packages, but no worries. We're certainly going to give you more information to help you understand how you can utilize this great resource within your organization. So the transplant change package, as you know, one of the aims highlighted in the Advancing American Kidney Initiative is more kidneys being available for transplant. Incorporating some of the ideas from the transplant change package may support dialysis facility efforts to increase the number of patients being educated, referred, evaluated, waitlisted, and transplanted. These ideas are meant to supplement what you're currently doing in your organization to help patients get transplant ready. The change packages are all organized the same with the bold aims and primary and secondary drivers. For this particular change package, the bold aim is increasing kidney transplants. The primary drivers contribute directly to achieving the aim, and the secondary drivers are specific, actionable ideas to test. As you will see shortly, these ideas can be incorporated into a quality improvement PDSA cycle, which is Plan, Do, Study, Act QI tool. Your network QI leaders are available to support your efforts in incorporating change ideas into your daily practice. So with pleasure, I'd like to introduce our FMC, or Fresenius Medical Care Claremore in Tulsa, Oklahoma, facility social workers. Megan Prock has been with Fresenius for 6 years, in the first 3 years as a facility social worker, and now as a manager of social work services. Rachel Simpson has worked with Fresenius for almost 2 years as a facility social worker and has worked in the social work field for approximately 8 years. In her current role, she enjoys collaborating with the interdisciplinary team to positively impact patient lives, both emotionally and physically, as well as supporting patients throughout the dialysis process. She is able to develop a strong working relationship with patients, and this offers her an opportunity to better help the patients on a more personalized level. With pleasure, I'd like to turn the call over to Megan Prock and Rachel Simpson.
Thank you, Gayla. And thank you all for giving us a few minutes to talk with you today. We're excited about sharing some of the elements from the change package that we've been using at the Claremore Clinic. And some of our clinics in Oklahoma have been working with our network quality improvement manager, Susan Waldron. And when she first asked or was talking to us about this call and using the elements from the change package, her guidance was to talk a little bit about our PDSA cycle, Plan, Do, Study, Act. And so that's what Rachel and I will do today. We'll kind of share some of our PDSA cycle and then share some of the elements that we've used from the change package. And we'll just get started. So Gayla, if you want to go to the next slide, that would be wonderful. So our objective in the beginning, which will sound familiar, was to increase the number of waitlisted patients and the number of referred patients in the pipeline. And we have a deadline of May 2023 is just kind of what we put our goal to be, because that's the timeline that we're working with Susan in the project. And so some of the improvements that we identified were more team communication and involvement. As the clinic was growing, there were changes in staff, so we definitely wanted to increase our communication. And then part of our strategy was to simplify our data. And one of the ways we wanted to do that was by each physician group. And we'll talk more about that. And then carrying out the changes involved meeting with the physicians to discuss patient barriers and medical suitability, educating staff, and early referrals, increasing communication with patients and the clinic team, and then collecting the data. Is what we're doing working? What is the data showing us? And then for the do part of the PDSA cycle, we wanted to start small. So we just started with one physician group and one team huddle. And I'm sure that you guys can all relate to this next bullet point of unexpected changes. So I guess I should change that to expect changes, because we're always going to have changes somewhere along the road. So there were schedule changes, with physicians, staffing changes, census changes along the way. And then implementing the action steps, we started in September. And so we were able to see an increase in our number of waitlisted patients and a steady increase in our number of referrals in the pipeline too. So that was exciting. We were just excited to see those increases. So I'm going to kind of tell you some of the change elements. If you want to go to the next slide, Gayla, we're just going to list the change package elements that we pulled out as a team at this clinic to really focus on. And so the first one, the numbers are the primary drivers, and then the numbers with the letters underneath there are the secondary drivers. If you recall from a few slides when Gayla was explaining the primary and the secondary, that's kind of how those are listed there. So we'll go into each of those bullet points individually on the next few slides. So if you want to go to the next slide, Gayla, that would be great. Thank you very much. So the first one is creating a pro-transplant culture. Those secondary drivers were creating a transplant champion. And for this clinic, it really made sense to have two transplant champions. The first one was Rachel, the social worker. She said in her intro, she's very passionate about helping patients create a better quality of life. And one of the best ways to do that is by getting a transplant and providing that hope of having that life that they would like to have. And so that made a lot of sense for Rachel to be one of the champions, as well as, working through barriers with patients and knowing kind of what the criteria was for getting waitlisted. And then having the clinic manager at this clinic made sense because the clinic manager has an interest in transplant. They have frequent interactions with the patients because they're often, working the floor and having that direct patient care. And at this clinic, the clinic manager was very involved in the admission process too. So kind of creating those first impressions with patients and providing some education from the get-go about transplant. So that was really beneficial for this clinic. It made sense for those two staff members to be those champions. And then we can go to the next part. So I am going to let Rachel talk to you a little bit more about implementing continuous quality improvement, because she had some really great ideas and strategies on using this bullet point. So if you would welcome Rachel Simpson.
Thank you, Megan. Yeah, so when looking at the second driver of our quality improvement for transplant, so we wanted to have a good knowledge of the transplant process and kind of where that started. So I was able to do that by reviewing a transplant tracker monthly. That's an internal report through Fresenius. And that was able to give me a tool to talk with not only the patients, but also the entire interdisciplinary team about a patient's interest in transplant and where they were at in the transplant process. And then also biweekly, I reviewed a secondary report that's put out through our agency that has more details from each transplant center. So it pulls from our transplant assessment. And that was able to really just improve communication again with the patient and with interdisciplinary teams to look at where the patient was at in the process and what some of the barriers they were facing and how we could support them through that to ultimately be listed for transplant. So something that I found that was really helpful was just engaging the physicians individually, but also the entire interdisciplinary team, going through those reports with them on a monthly or sooner basis. So I started by creating a patient list by each individual physician and then reviewing those lists with the physician and nurse practitioner to discuss any barriers, any comorbidities, and how we could, again, support the patient through those barriers. So a couple that I was going to mention, barriers for our clinic. We are a rural clinic, and so access to transplant centers is often our biggest barrier. We have a lot of rural patients, so getting them to the appointments is a big challenge for us. Another that I was going to highlight and kind of how this process was successful is that we had several patients who were not interested in transplant due to amputations, and through talking with their physician and with the patient, we were able to identify the source of that hesitancy and get them appointments with their primary care doctor so that they were able to start the process to be fitted for a prosthesis. So that's kind of an example of how communicating with the physician gave us a better idea of where the patient was at in the transplant process and how to support them through that referral. Another step that we took was creating a transplant binder, so something that we keep on the treatment floor where we keep all documentation related to transplant, so any correspondence, any letters, any updates from the individual transplant centers so that each staff has access to that. In the event that I'm not there, they're able to answer any questions from patients about what their status is or the questions themselves about where a patient is in the transplant process. So I think lastly, I was able to use all of those tools to really just review the overall process with patients. So some tools that we use to do that was a Pathway to Transplant handout that is an internal handout to kind of review the transplant process, who's involved, and what patients could expect. And I found that kind of helped with expectations and keeping the patients accountable. So I really tried to encourage them to have that ready at any transplant appointments or with any important updates that they received, any letters or phone calls, so that we could all keep a good idea of where they were at throughout that process. And then I really just encourage them to follow up with the transplant center often. I communicate with the transplant centers on a biweekly basis at minimum to see if there's any barriers that I can help address with the patients as well.
Thanks, Rach. I appreciate you being on camera too. And
Thank you.
I'm sorry that my camera is not on, guys. My new laptop, I had some issues there, so I appreciate your patience with me there. But yes, thank you, Gayla, for going to the next slide. So the third point that we implemented was continually following up on the transplant status. So this one seems kind of like a no-brainer, but it was nice to have all of these bullet points to kind of keep us on the right track. So the first one, providing patients with knowledge and tools. Part of what we do as a social work team is to assess their knowledge of transplant and what do they know about what it takes to get a transplant, what it means to go through the workup. And, it's not just one appointment and boom, you're waitlisted. So really kind of setting those expectations and assessing their readiness to change because they're there probably are some things that the patients will have to change along the way. So that was key. And then using the tools that Rachel was discussing to set expectations. Our pathway to transplant is really a detailed tool that gives the patients a list of steps that will be involved and helps them kind of check things off. And it's a really nice guide for them to keep along the way. And then obviously supporting the patient with following up with orientations, doctor appointments, testing, etc. And then acting as a case manager throughout that process. So we want to help the patients navigate those steps and celebrate those successes. And communication is definitely key. So having that kind of go-to person at the transplant center. So cultivating those relationships, knowing who your people are that you can connect with, who you're going to get an email back faster from, who's going to return a call a little bit quicker, and just kind of having your go-to people at each of the transplant centers that you have access to. I think that proved to be really helpful for us as well. And then the last point is educating and supporting patients throughout. That was the, if you want to go to the next slide, Kayla. Thank you. So providing early education, part of what the clinic implemented was when the clinic manager was educating the patient during their admission packet. Part of that education was about transplant. Part of their first initial assessment is about transplant. And so when they're having those conversations, if the patient expressed any interest in transplant or questions or any indications that they'd want to have more conversations about that early on, the clinic manager would then communicate that to Rachel as a social worker, and then she would continue that conversation and get that referral started early. And then as a best practice, our social workers are educating patients within their first 30 days of admission as well. So that kind of, you never get a second chance for a first impression. So having that those multiple conversations from multiple staff members about the importance of transplant and the options that patients have to go through that process, I think has been really beneficial. And then the second one, offering support throughout the process. So obviously using the handouts that Rachel has mentioned, and then encouraging the patient to contact the transplant center often, especially if any changes. So, definitely with address, phone number, that kind of thing, so that they stay in close contact, and then educating about any like traveling, whether it's short-term or long-term, and then continuing to discuss living donor options. So as patients get more comfortable with the idea of what the transplant process looks like, they might become more comfortable and confident in talking to family and friends about living donor ideas as well. So that's been something that we've been trying to work on a little bit more as well. And if you want to go to the next slide, it'll take us back to our kind of study act phase of our plan, do, study, act cycle. This is kind of where we are now, like looking at our data results. We were able to increase our wait list by 8% from August to February, which is a pretty good turnaround, we thought. And we increased our number of referrals by 88% from August to February. So that did exceed our expectations, and we're super excited about that progress and future progresses. And then continual education, because like we talked about earlier, change is going to be constant. So whether that's patient census, whether that's staff, whether that's staff at the transplant centers. So just constantly educating everybody around us about transplant and where our patients are in transplant and what we, can use some collaboration on together. So I think that's one of the things we've definitely learned over the last several months, is that communication and education is key. And we're kind of still in the ACT phase too. So we're just starting to implement some of the same steps at other clinics and hoping to see an increase in waitlisted patients as well. And we are seeing an increase in referrals in the workup process. And then, if we're successful, we want to keep on doing what we're doing and build on that. And if these same steps, maybe, if they aren't as successful at other clinics, then we'll reevaluate and see what we can do differently in a different environment. So constantly kind of just reassessing and seeing what's working and what's not, and what we can do to make it better. So I think that's ready for the next slide. So thank you, Kayla. The next steps are just how do we keep this going? So we want to continue our current action steps, definitely, and continue with staff education, because I'm sure you guys can relate to staff changes, growing census, so you need more staff, and changes between different clinics. So I think that's a constant. And then improving communication, just continuing to build those relationships with the transplant centers, build our relationships with our physicians, and then just constantly keeping transplant at the forefront of the conversation. And the last two boxes are things we're like in progress with right now. Like, so we're really working with our network liaison, Susan, and kind of learning more about multi-listing opportunities and learning more about different OPO considerations, because some of our challenges have been that we do have a limited number of transplant centers in our state, and geography is a real barrier. So, what are our other options for helping patients be dual listed? And for those of our patients that can travel, what other options might they have to get waitlisted during, using other OPO systems, and just kind of learning more about what we can do to better support our patients in those aspects. And I just want to thank you guys for your time. I want to thank our team for just being willing to kind of take on this challenge of helping our patients live their best lives. It's part of our, mission statement. And I'm just excited about the progresses that we've had, and excited about future successes that we will be seeing. So it's an exciting time to be helping patients with transplant.
Great presentation, Rachel and Megan. Thank you so much for all the hard work that clearly is showing successful within the Claremore Clinic and other surrounding clinics there in your geography. So really appreciate all the great work that you're and that great outcomes that we're seeing as well. So we have a couple of questions in our chat. So a question from Kimberly Emmer. Where can I get this pathway to transplant form? So can one of you ladies maybe speak to that?
Is that from a Fresenius employee? Do we know?
So Kimberly, are you with Fresenius? I know this form is internal to that organization. And if not, we certainly can work with your network lead to get some, a similar resource for you as well. And also on the NCC the National Coordinating Site, we also have some tools that you could utilize as well. But if you are with Fresenius, feel free to reach out via email, and I can connect you with these ladies and they can share that resource with you. All right. And a question. Oh, yeah, absolutely. Absolutely. And a question from Susan. Susan is the network lead for these two ladies. So have you had feedback from the physicians about being more involved and or about your successes? So Megan or Rachel, can you speak to that?
Rachel, you probably have more direct experience with that. So do you mind taking that one?
So I think all the feedback that I've gotten from the physicians and nurse practitioners has been really positive. As Megan mentioned, we had quite a few staffing changes at our clinic, which included our medical director. So I think it was even a good opportunity in that instance to just be able to get more familiar with the patients and where they were at in the transplant process, and also address barriers that maybe were now irrelevant, or comorbidities. And so, like I said, I think all of the feedback that we've had from physicians has been really positive. I've implemented the same process at my other clinic, and it's been really successful there as well.
Awesome. Very good. Very good. And we have a question from April. How do you organize your transplant binder? I just made one, but I'm afraid it's too intuitive. So can you share your process with how you organize your transplant binder?
Sure. So I alphabetize all of the correspondence by patient last name and then just keep the most relevant information up front. I also have separate tabs for each of the 3 transplant centers in the state to where I keep any reports that I get throughout the month or quarterly of all the patients that have been referred. Something I forgot to mention as well is I keep the referral forms in the binder so that if a nurse or a physician or whoever wants to refer the patient, those are readily accessible as well, and they don't have to wait on me if for some reason I'm not at the clinic.
Very good. Thank you.
Thank you.
All right. And so just responding back to Kimberly, so if you, and I'll drop our email address in the chat, nccinfo@hsag.com. If you want to email us, I can try to connect you with the transplant center in your area that you have listed here. So just email us. It's nccinfo@hsag.com, and we'll try to get you connected with your transplant center. All right. So we have another statement. So we no longer recommend to list in more than one center because of the distance. How do you handle the 250 nautical mile area? What is the closest transplant center? So is that something you're familiar with as far as the donor service area and the 250 nautical mile? Or can you at least speak to what is the closest transplant center to your facility that you most frequently refer to?
Yeah, so in the Tulsa area, we have one center that's kind of within a 25 to 50 mile radius, depending on which of our clinics in the Tulsa area that we're working with. And then there are 2 in the Oklahoma City area, which are over 100 miles from where this clinic is located. So that's, your question is spot on though, because that's exactly kind of what we are trying to figure out as well. Like in terms of if we're able to have multi-listing outside of the different OPO system, and if does that open up any more opportunities for our patients, even if it's within the 250 nautical miles, but it's a different OPO. So that's an area we're still exploring more information on to see if there are any benefits to our patients, because in Oklahoma we don't have any centers that are like sister centers, so we don't have a ton of opportunities for dual listing right now, but we're still kind of learning more about that, and if there are any opportunities that make sense for our patients to explore.
Great, thank you. Thank you, Megan. It looked like there's another follow-up question for you, Rachel, regarding the binder. So do you only keep the most updated report in your transplant binder?
So I keep all of the information for all of our current patients and then just the most recent up front. I find that it's helpful to be able to go back and reference any correspondence I've received, even if it's not the most recent. So it can get to be a pretty hefty binder for all of the patients, but it's been really helpful in kind of remembering some of the correspondence we've gotten. So long story short, I keep all of the information, just the most relevant up front.
Very good. Thank you. All right. So I had a private question to come in. How do you assess the patient's knowledge and their readiness for transplant?
We have some really great tools. So one of the ways to assess their knowledge is just using our knowledge assessment tool that just goes through some very basic questions about a patient's understanding of transplant and the evaluation process and who their support person might be and who might help them navigate that. And then for their readiness, we use our motivational interviewing tools, like looking at the, this readiness for change scale and how confident, on a scale of 1 to 10, how confident are you that that you can make these changes, or how important is it to you to get a transplant and things like that. So we use some of our internal tools, but also some of our, basic social work skills as well.
Very good. Okay. And how do you keep patients motivated as they move through the transplant referral and the evaluation process?
I think one of the ways, and Rach, jump in with any comments you have too, but one of the things I think that's most successful is reaffirming the patient's past successes, and even if it's not transplant related, just reminding them of when they've been successful in the past, and then anytime they have any progress in the referral step, in the workup process, to make a big deal about that, and just continually affirming and reaffirming the patient's progress.
Absolutely. I think celebrating the little successes and then just reminding them often that that's what they've mentioned their main goal to be, is to work towards transplant, and kind of reaffirming that, as Megan said.
Awesome. Thank you. All right. Look like we have one more question. Your transplant binder is quite popular. Do you keep any documentation in the patient's chart, or just a binder as it relates to their testing and their various appointments?
So I keep all of the paper letters that we get and any email correspondence in the binder. Fresenius does have an internal transplant assessment that we complete, that we can electronically document the same information. But as far as physical, we upload it, like physical correspondence, we upload it to their electronic chart, and then I keep the physical copy in the binder. So it's a little bit of both.
Gotcha. So I'm going to put our email address there in the chat. I know there's lots of questions regarding the binder. I'm happy to connect you with Megan and Rachel if there's additional specific questions that will help you. Maybe they can share their process with you. All right. Are there any other questions or comments from our audience, our participants? Awesome. Well, again, thank you so much, Rachel and Megan. Again, great outcomes. Thank you to Susan Waldron for connecting me with the two of you. Would love to see the success that you're having within your organization, and looking forward to ongoing success with your initiative. So I'm going to move forward.
Thank you so much.
Yeah, absolutely. Another question from Kimberly. So what do you think is the biggest thing you could do to increase transplant referrals? If you could do only one thing, what would that one thing be to increase your transplant referrals?
I think what I've noticed, Kimberly, is just following up with patients on a regular basis. I've had several in the past 2 to 3 months throughout this project that initially were not interested in transplant, or have been on dialysis for years and have never expressed interest in transplant. And just with reaffirmation of their goals and what they want their quality of life to look like, they've, I think, kind of made that step to explore transplant referrals. So just constantly touching base with the patients on what they want their goals to be in life has been the biggest success.
And I would add to having the physician support, because that, I feel like, has been a big piece of the success. Rachel, whenever you leaned on the physicians to say, look, these are your patients, and these are, I need help looking at like the medical contraindications and who is a good candidate on paper, and really
Absolutely.
opening up those conversations and letting the patient know, hey, your physician is thinking that this could be a great thing to explore, and then having that conversation together. I think that's been really impactful, having that physician
Absolutely.
support.
Absolutely. And also, just to give a little bit more detail for those on the line that's not as familiar with what type of testing is required for transplant. So most patients, when they get their evaluation done, they're getting chest x-rays, they're getting lower extremity Dopplers, look at the patient's vasculature. They're getting abdominal ultrasounds. They're getting cardiac clearance, especially if they have a history of cardiac disease. Some of those routine testing that's needed are like colonoscopies. For our females, they need mammograms, dental exams. So a lot of, and also depending on that the patient comorbidities, they may need other clearances from other physicians that they're seeing. So it's a very extensive process in terms of getting through the evaluation. Once the patient, have the initial referral in and getting through the evaluation to listing. So any of those routine health-related screenings that patients can take care of early in the process will really help them transition into being waitlisted, hopefully a little bit sooner. So like the colonoscopies and, like I said, the dental exam, those are some of the routine screenings patients, when they get a certain age, as far as colonoscopies, they'll need anyway. So again, just wanted to highlight some of that testing that patients are experiencing as they're going through that evaluation process. Are there any other last minute questions? All right. So we have one other polling question, and if you can drop your response in the chat, which is located at the bottom right-hand corner. So now that you've heard this presentation, what is the likelihood that you will use some of the ideas from the change package? Seeing some really good responses, likely and very likely. Great information we'll discuss and use with my team. Awesome, seeing some great responses. Super glad this was helpful to many of you. Enjoyed the presentation, very likely it was very helpful. Very likely and already doing some things that we talked about, that were talked about, and wanting to bring it to your team. Awesome. Really happy to see that this information was super helpful to many of you. Oops. All right, so again, in any learning and action call, we want to move from the learning phase into action. So as many of you have already stated in the chat, you're going to share some of those best practices from the presentation with your colleagues. Again, just to highlight the change packages that are currently already available. It's the transplant, which was shared on the call today. We have one for home modalities, for hospitalizations to help take some best demonstrated practices to reduce some of those avoidable hospitalizations. We have vaccination, as well as the patient's experience of care change package. And again, this can be used solely or as a supplemental resource to what's currently you're utilizing in your organization. And also, again, just to note, depression is in development now, as well as access to care for nursing home patients and health equity. So be on the lookout for those resources in the coming weeks. And then we're also located on social media. So on Facebook, presentations you'll find from the ESRD National Coordinating Center on Facebook, on Snapchat, on Twitter, as well as we have a YouTube channel. And of course, our website is ESRDNCC.org. Again, thank you for your time and attention today. Really enjoyed having so many of you on our call, and super excited to hear that this information was very helpful. Again, like to thank our presenters, Megan and Rachel, our network and CMS colleagues, many of our transplant centers, as well as our dialysis centers and patients and families on the call today. At the end of the call, please take a few minutes to respond to the post-call survey, which should populate into your email as soon as we end the call today. So if there are any more questions, again, thank you for your time and attention today, and have a great rest of your day. this is the end of our call. Thank you.